Okay, here we are in October. Happy October, everyone, and thank you so much for coming to today's meeting. Today we most likely won't have time for breakout rooms, so I just put on our agenda an update about our progress as well as an open discussion. So it is October. Happy October, everyone. It's also a great month to visit your congressional leaders' home offices. Congress is not in session, and most of the congressional leaders, if not all, are home either campaigning or meeting with their constituents or a little bit of both. So if you want to have in-person meetings with your leaders, it's a good time to call the office, stop by, bring some flyers with you, and get an opportunity to have those in-person meetings, which are very persuasive. As you know, we are sprinting to the finish line. We know people who are dying on the wait list, and without this bill, we will have a situation like we did from 2010 to 2021, where we lost 100,000 Americans from the kidney wait list. We do not want another decade to go by where people are dying needlessly and suffering at very high rates. This comes from Dr. Louise Andrew. I sort of adapted it a little bit. I thought it was really excellent. You only need one kidney from one donor for one life saved. So let's pass one law. Let's pass the End Kidney Deaths Act. So I'm going to skip that slide. So our aim is to live in a country where no American will die while waiting for a kidney. That is the ultimate aim. As we know, we're starting with non-directed donors for a 10-year pilot program. And we imagine it will go incredibly well and we'll save the lives of people who would otherwise die from the kidney shortage. And then we will campaign and advocate to extend this tax credit to all living kidney donors. As we know, the plan is to save 100,000 lives in the next decade, people who would certainly die from preventable deaths. And I just love this photo of, it's about 107,000 people, I think, in the Michigan Stadium, but pretty close. It's just astonishing how many people will be positively impacted by the passage of the End Kidney Deaths Act. At our last meeting, we had only two co-sponsors for our bill. They were the original co-sponsors, and now we have 6. We need far more, but it is good progress. Here they are. Representative Harder and Maliotakis are, of course, our co-leads. And then Representatives Neguse and Bacon were our original co-sponsors. And new co-sponsors are Representative Holmes Norton, Representative Desposito, Representative Peltola, and Representative Van Orden. And it's very important for us to thank the leaders, the lead sponsors and co-sponsors in your social media posts, and you can also tag them. I think we want to give the idea to everyone who supports us that we will express our gratitude publicly. It is a great thing to be attached to this bill because we are a grateful community, and we need to show that, I think, through social media. So if you want any support in developing posts, I'm happy to do that. Here's an example of a really impactful post that one of our original co-sponsors, Representative Don Bacon from Nebraska, wrote. This was on September 11th, the day before our lobby day, which we'll be talking about in a few minutes. Our lobby day was on September 12th, but we had a long conversation with Representative Don Bacon about the bill, and I got a little bit of interviewing of Don Bacon on video, which is excellent. We'll be sharing, and as you can see, it generated 84,000 views on Twitter, right? So this can be really helpful to us to post and to also comment on other people's posts related to the End Kidney Deaths Act. Meetings so far. I put in parentheses the numbers from last month to let you know how much progress we're making. As of last month, we had 230 meetings. Oh, sorry. Last month, 158 meetings with House reps. This month, we are up to 230. Last month, 76 Senate meetings. This month, we're up to 88. So we have met with a total of 318 members. That's 60% of all congressional leaders. So we're making good progress on our meetings, and they have been very positive. As we know, kidney donation is time-consuming, painful, and stressful work, and that's something that I emphasize in my conversations with congressional leaders. And we know that it's important to pay people for difficult work. And so the End Kidney Deaths Act was founded by donors, and it is primarily supported by donor organizations. And we use the tax credit system to incentivize and encourage people to conduct themselves in pro-social ways, like buying homes, adopting children, having children, getting married. And we believe it's very pro-social to have your body opened up and give a healthy part of yourself to someone you don't even know so that they can survive and thrive from kidney disease. We also, interestingly enough, provide tax credits for people who buy electric cars, solar panels, and even racehorses. So there are all kinds of different ways people can earn tax credits. There was a superb article published this month by Dylan Matthews, a non-directed donor. And Dylan writes about how compensation has been banned, as we know, for the last 40 years, and that admitting a mistake for the past 40 years is hard. It's also good to remember that the people who authored the National Organ Transplant Act, NOTA, said at the time that if we have a shortage of donors, we should consider tax credits. We could have saved a lot of lives if tax credits were in place. And that each year, 47,000 people die prematurely due to the kidney shortage. And failing to pay donors has killed a lot of people. So here are Dylan's 3 bad arguments against paying kidney donors. These are very important. Kidney donation is too dangerous. As we know, kidney donation has become 3 times safer in the past 15 years. There was just a wonderful new study that is out, and loggers die at 10 times the rate of the one-time risk of kidney donation. No one would credibly argue for banning the practice of roofing because it's too dangerous. Why should that argument work for kidneys? Here's the second argument. Kidney donation exploits or coerces the poor. Offering money to donate will disproportionately push poor people to become donors. I hear this a lot. It's a real concern that constitutes exploitation because they would not have donated without the compensation. But in the words of Professor Richards, this applies to just about all paid work. Unless you would do your job for no payment, anyone who employed you or bought what you offered for sale would, in this sense, be exploiting you. It would be silly to draw the conclusion that wage labor should be bad and that workers should not be allowed to be paid. And then we hear this word coercion. Coercion means threats or use of force to limit a person's options. Paying for kidney donation expands options rather than limiting them. And don't forget, 95% of donors surveyed state they would do it again if they could. In terms of this argument, which you're going to hear a lot in a few minutes, it's important to know that low-income people suffer the most from the kidney shortage, and the most important thing we can do for low-income people is to increase the number of donations, and that the current system is prohibitively expensive for low-income people, especially those living paycheck to paycheck. Just having donation be cost neutral, which it is for most donors who are reimbursed for costs and lost wages, is just not enough because donation is disruptive to work. And End Kidney Deaths Act is the only bill that actually levels the playing field. I gotta admit though, for a person who's living paycheck to paycheck, getting a $10,000 tax credit in the following year would still most likely make donation not affordable for those who are most low income in this country. And this, I think, is the most important point. That the idea that the low-income people will donate their kidney against their better judgment if there's a tax credit is unscientific, paternalistic, and totally ignorant of the actual mechanisms of the End Kidney Deaths Act. It's important to know that transplant centers do a very thorough job of evaluating candidates. Of 100 people that step forward to donate, only 2 actually donate. Most are medically disqualified. And people who are giving kidneys to strangers need to see 2 to 3 mental health experts and get the sign off from them that they are qualified. If you're donating to a relative or a friend, you need to see 1 mental health expert. So the transplant centers do such a superb job of evaluating candidates that living kidney donors live longer than the general population. And here's another one. We'll get fewer kidney donations if donors are compensated because it will no longer feel altruistic. This is a great line. In a shocking twist, paying people for their work results in more work being done. There was a survey done by the National Kidney Donation Organization of its membership, and 98% stated that having a tax credit would have either made them more likely to donate or as likely to donate. And there's no other area of human life where we assume that monetary incentives are actively counterproductive. We do not worry that paying salaries to doctors and nurses will crowd out their altruistic reasons for working in healthcare, or that letting firefighters accept wages crowds out their natural desire to save people from burning buildings. The correct response is people donate more blood when they're paid to donate blood. And the correct expectation is paying people to donate kidneys is that they'll donate more kidneys. And remember, we're paying them for the work of donation. Also important to know that compensating donors is favored by the majority of American voters and the American Medical Association of the medical community. There have been 4 surveys that I could find that are in which Americans have stated, the majority of Americans, that they support compensating kidney donors or organ donors. And of course, I've stated this many times that the AMA supports well-designed studies to investigate the use of incentives. These are our supportive organizations. We are having some opposition from organizations that are kidney organizations that are patient organizations, which is something kind of unexpected. And that would be from the American Association of Kidney Patients, American Kidney Fund, American Society of Transplantation, American Society of Transplant Surgeons, and the National Kidney Foundation. Those organizations generally very much support the Living Donor Protection Act, far more than the End Kidney Deaths Act. And I've talked about this earlier, but I just want to say it again. The Living Donor Protection Act has 2 components. One is Family and Medical Leave Act protections. These are already in place from the Department of Labor. The bill would, if it goes into law, would codify those FMLA protections into law. And in addition, 33 states have already passed a ban on the insurance discrimination. Constitutionally, the states govern insurance. So even if the law passes on the federal level, the 17 states that have not yet passed it do not have to pass it. It's a message to them that they perhaps should pass it. But the fact that we have the majority of states with the insurance discrimination protection, and we have for all American donors, the FMLA protections in place, and yet we've had no increase in the number of living kidney donors as a result. In fact, we haven't had an increase for a quarter century, for 25 years. I would safely guess that passing the Living Donor Protection Act will not increase the number of living kidney donors in any kind of noticeable way. Now, there was a letter written in April of 2023, signed by AST, ASTS, and AAKP, and it stated, and I'm just going to read the bold part, that paying for organs would disproportionately harm the poorest and most vulnerable among us, and that such incentives raise serious questions about financial coercion of potential donors, which is completely unacceptable. Important to know that, again, these arguments against saying it's going to harm the poor and that it's coercive, and that was addressed in Dylan's excellent article. The American Society of Transplant Surgeons membership has twice demonstrated, keep in mind, this is the membership, their support for pilot programs of compensation for organ donors, and the American Society of Transplant Surgeons, American Society for Transplantation membership did once. So here is the quote from 2009 survey. There's strong support for government-related regulated trial to evaluate the potential benefits and harms of financial incentives for both deceased and living donation. So that's what we're doing, a government-regulated trial. And then here was a 2015 ASTS work group in which they said, we believe it is important not to conflate the illegal market for organs, which we reject in the strongest possible terms, with the potential in the US for concerted action to remove all remaining financial disincentives for donors and critically consider testing the impact and acceptability of incentives to increase organ availability in the United States. ASTS recently wrote one of their employees wrote this in an email. The ASTS does not support this legislation, meaning it was the End Kidney Deaths Act she was speaking about. We are concerned about financial incentives that may turn coercive. Again, that word being used, and especially the impact this could have on marginalized communities. And then Ms. Schultz writes that they support the Living Donor Protection Act, a bill that will most likely not have a big impact on saving more lives. In terms of the American Kidney Fund, their president recently said this in an article that came out in September. The current legislation does not have any protections in place to ensure that the most vulnerable do not donate organs simply because of the cash payment without regard to their own current or future healthcare needs. you know, this is a person who's the head of a major organization. She should know that the transplant centers are very thorough and only approving people who they believe very strongly will not be negatively impacted by kidney donation. The idea that this is just going to open up the floodgates for reckless approval of kidney donors is misleading. This is the statement from the National Kidney Foundation. Traditionally, NKF has had very strong reservations about direct financial incentives that go beyond making kidney donors financially whole, such as those included in the End Kidney Deaths Act. The potential for unintended consequences are high, such as the exploitation of people who are financially desperate and the potential to turn kidney donation into a profit opportunity. And then skipping ahead, NKF is monitoring the End Kidney Deaths Act, but has not taken a direct position at this time. I just want to say that there was a tweet today. I know I've spent some time on Twitter with this whole thing. And Miriam Godwin, who runs the health policy of NKF, was writing about the End Kidney Deaths Act and stated, this policy debate has holes you could drive a bus through, namely conflating the ability of donors to profit off their donation and the ability of donors to be compensated for the cost they incur. The actual policy is meant to do the former, so let's have a debate on those terms. So NKF, you know, employees are tweeting against the bill. I have an open offer to all of these organizations to have a public debate with them. I think that would be very productive. I don't know if anyone's going to take me up on my offer. Some updates I'd like to let you know about. Please, if you're interested and you think it's a good idea, print out the flyer. I've included it on multiple emails. I'll include it on the next email as well. Please pass those out. I think that can be really effective. They have our QR code there. Interesting also to know that only 7% of bills that are introduced actually pass. We really need to be very persuasive and get this to become a national movement in order to get this bill to the finish line. If you have connections with state congressional leaders, they can be very helpful. 3 of them in 3 different states, Colorado, New York, and Georgia, have offered to send a letter around to their colleagues to have it signed and then sent to their state, their federal delegation, encouraging them to support the passage of the End Kidney Deaths Act. So if you have any state congressional leaders that you know, please introduce me to them and perhaps they would agree to do something similar. I also wanted to mention that Mike Lalo, who was working very closely on different kinds of work to help this bill get to the finish line, has now a full-time job. So he's now returned to being a volunteer like all of you. He's going to be working with in deceased organ donation on transplant logistics. So congratulations to Mike. Also wanted to make you aware that there's a non-directed donor running for state senate in Florida, and he has written an op-ed in favor of the End Kidney Deaths Act that will be published shortly. And if you're interested in getting updates on the End Kidney Deaths Act, you can set a Google alert, and that way you can know about the articles that are coming out about it pretty quickly to the time they're published. This is the backside of our flyer. I just wanted to show you that it has very simple directions on how to fill out the action button, which is that quick way to get in touch with your congressional leaders. We've had some really good press in the last month. Today, there came out a podcast on the Atlantic, in the Atlantic, with Dylan Matthews speaking with journalist Jerusalem Demsas. Also, we have that article that I quoted from with the AKF quote in Mega Doctor News. We have Dylan Matthews' article from Vox. There was a CNN regional article about Representative Harder's support for the bill, and also a video news story in Sacramento on CBS Local News. A good article as well in Charlotte and in Raleigh. So very, very good news. We need, of course, more publicity. If you're willing to write an op-ed, I'm happy to help you get it published. If you have any news media connections or you just want to call your local news station, it could be an excellent opportunity to get a great story going. The action button, I'm aiming for 90,000. That's as many people as we have on the wait list. We've had 1,062, so we've got a long way to go. If you know people who have not yet clicked the button, please have them do it. This is a great way for congressional leaders to hear about the bill and understand that their constituents want it to pass. So please share that action button everywhere you can. Also, there was a suggestion from one of the community members to have T-shirts that are affordable, and so I'm working on that, and we should have news about that in a few days. So I'll send that around. I think the shirts are going to cost $25 each. And if you have any suggestions, anything about this T-shirt, please let me know in terms of color and design and things like that. Lobby Day was a massive success. It was one of the best days of my life. September 12th, I will always remember that day. We had 55 meetings, 35 participants in person and 12 virtual participants. And I had an additional 23 meetings that week. It was absolutely spectacular. Here's a picture of the delightful group right after our rally. It was just such an amazing day for advocacy. This is that evening. We have a little cute banner, and this is some of our group. Everyone was, at least I think everyone was really happy with how things went. And this is a picture that gives me a good laugh. It's me with Senator Ossoff from Georgia. My kidney happened to fly to Georgia as I launched my kidney chain. That was its first stop. And this was just a great opportunity to get a nice photo. Now, Kidney Donor Athletes is a group of exactly that, and they are very fortunately going to advocate very hard for the End Kidney Deaths Act to pass. It's one of their main components that they are working on, and so today was the day of their launch. So if you're on any kind of social media, please join and start following Next Step, Next One. I'll also put it in our email. It's a great way to see. I think every fourth day, if I remember, they're going to be showing. They're going to have a video or some sort of advocacy for the End Kidney Deaths Act. I'm really grateful, and I'm going to show you their first piece in just a moment.